and we will be discussing reducing health disparities in our community. My name is Jonah Dean.
I'm Alyssa Couples.
I'm Ibrahim Mirza.
I'm Hosa.
I'm Kaylee Milligan.
And I'm Sayed Show.
In 2019, we experienced the lowest poverty rates we've seen within the last 5 years. But due to COVID, we've experienced many salary shortages and loss of jobs. Poverty limits access to resources that enhance the quality of life, which has significant influence on people's day-to-day life and normal living.
Social detriments of health are the conditions in the environment where people live, learn, play, and work. They focus on the quality of life and the potential risks and outcomes. Social detriments are grouped into 5 domains: economic stability, education, social and community context, neighborhood and built environment, and health and healthcare.
Adjusting to the new life with COVID-19 has been proven to be a struggle for everyone. Schools have done their best to accommodate and provide ways for students to learn. Unfortunately, families with zero to no income are basically forced to attend in-person school. They might not be able to afford a computer, and if so, they might not have access to internet. In these situations, parents have no other choice but to send their kids in person. This ultimately could lead to an even worse situation. If the students are exposed, they could spread it to their family, and the medical expenses that could follow could put that family into an unthinkable situation. Our potential solution is using churches and different kinds of centers as student learning centers where students can go and learn and do their schoolwork, and it would have free internet and free Wi-Fi for the kids, and having different kinds of drives for Chromebooks so you can donate your old ones.
In the United States, 1 in 10 people live in poverty. More specifically, in the greater Houston area, the unemployment rate has risen to 14.2%. Economic stability covers a person's employment, housing, and well-being. This is detrimental to their quality of life. A way that we could help with people who no longer have jobs are to hold job fairs in community places such as town centers or libraries, and for employers in our area to create more jobs by making more half-time jobs. It would cut the salary in half, but distribute it to 2 different people, and especially in a time of need, anything is helpful.
Our health is also determined by access to our resources. Poverty may limit one's access to the proper medical care and the proper personal protective equipment, also known as PPE. PPE consists of masks, gloves, hand sanitizers, and other basic necessities that we consider everyday items. In extreme situations, if you cannot afford a mask or access a mask, you may not be able to go to the grocery store to buy food and water, which are necessary to provide for yourself and your family. Another example could be with the COVID testing. COVID testing can cost up to $130, and failure to get tested may lead to you not being able to show up to a job interview or even visiting your family. We have a possible solution for this, which would be a mask drive or a PPE drive, where you come and we can give out free masks, gloves, and hand sanitizer.
Neighborhood and built environment. Drugs and alcohol have been a big issue, and it's growing rapidly in the youth. Peer pressure plays a big role in this. 5,000 people under the age of 21 have died a year as a result to driving. 31% of teenage car accidents involved a drunk driver. Reasons for substance abuse, as I mentioned earlier, was peer pressure. This is a big deal in high schoolers especially. A way that we can fix this is by educating the youth on the effects of this. It could become an addiction or result in death. Recently, our school was fortunate enough to bring in a speaker who talked about his life, how it was affected by drugs, and he came to better himself out of it. And for us, I thought that that was a very eye-opening experience, and if we were allowed to bring these speakers to other schools and have other students be able to hear him, it could save a life.
Social community and context. A major issue in our community is racial profiling. Oftentimes when we're at school or just hanging out with friends, we'll hear students use stereotypes such as rich white kid, but oftentimes we don't realize it until it's too late. We'll hear kids using phrases such as daddy's money when they see a student wearing an expensive item. But we don't know what that student had to go through or what their parents had to go through to get to where they are right now. and what sacrifices they had to make. A simple yet difficult solution to this problem is changing how we perceive others. Instead of judging people on their skin or how they appear, we should judge people on their actions and how they treat others.
Together we can change. Okay.